Hi, I'm Doc Leia. I'm a certified board gastroenterologist from Shinagawa Diagnostic and Preventive Care. Endoscopic procedures are minimally invasive procedures that examine the gastrointestinal tract. Both transnasal endoscopy and gastroscopy evaluates the upper digestive tract from the esophagus, stomach, down to the duodenum. Colonoscopy, meanwhile, examines the large intestine even up to the terminal ileum. Endoscopies are conducted to investigate the gastrointestinal tract for detection of ulcer, abnormal tissue growth, obstruction, and determine etiology of symptoms. Upper endoscopy is indicated in cases such as persistent abdominal pain, difficulty swallowing, heartburn, vomiting, abnormal weight loss, black stool, and evaluation of anemia. Narrowing are blockages seen in imaging of esophagus or stomach, hiatal hernia, and cancer surveillance. Colonoscopy is indicated for signs and symptoms of problem in the colon, which includes bleeding, unexplainable abdominal pain, sudden changes in bowel habits such as diarrhea, constipation, or incontinence, unexplained weight loss, and for screening and surveillance of colorectal cancer, evaluation of abnormal gut imaging, detection and surveillance of inflammatory bowel disease. Endoscopic procedures uses flexible tube with camera and working channels. Both transnasal endoscopy and gastroscopy examines the upper GI tract. The two procedures differ in the tube's use and the entry point. Transnasal endoscopy uses thinner tube measuring 5 mm and inserted through the nose, whereas gastroscopy uses a slightly bigger tube around 15 mm and inserted through the mouth. The advantage of transnasal endoscopy is that it has increased patient tolerability since it avoids triggering the gag reflex, and patient can resume on their usual activities without the after effects of sedation. However, gastroscopy is advantageous for more complicated procedures that require a thorough evaluation and hence therapeutic procedure. Colonoscopy uses a longer tube than the gastroscope, around 135 to 185 cm in length, depending on the type and the manufacturer. Technically, there is no age limit for endoscopy, but the appropriateness vary depending on age and symptoms. In the Philippines, as well as most countries, colonoscopy is advocated for anyone 45 years old and above for early detection of colorectal cancer. Endoscopies are performed depending on patient's condition, race, and findings during procedure. In the case of esophageal cancer surveillance, endoscopy is recommended every 5 years. Gastric cancer surveillance for high-risk patients such as the Japanese and Korean is recommended every 1.5 to 2 years, but shorter interval is necessary for younger subpopulations. Colon cancer surveillance is conducted depending on the type of colon polyp detected. The specialized training with the Japanese expert provided us with the advanced techniques, hence it has given us increased confidence in the performance of these procedures. As like in life, thorough preparation enhances the effectiveness and efficiency of the procedure. Transnasal endoscopy are not typically performed here in the Philippines, unlike in Japan, and there are other indications as to the performance of such procedure in the Philippines. The Japanese approach uses more thorough preparation using longer topical anesthesia and defoaming agent. Japanese healthcare are more detail-oriented and more on preventive approach with enhanced technology. Diseases are diagnosed early, hence treatment is instituted earlier, and this leads to longer survival rate. Prevention is better than cure. It should be emphasized that early detection leads to early treatment and longer and healthier life.